Hi, I'm Vivian Wang. Thank you to SAGES for the opportunity to present about expectations versus reality, trainee participation on the robotic console in academic surgery. As demand for robotics in general surgery increases, robotic curricula are rapidly becoming adopted by general surgery residencies, but are not yet standardized. In open and laparoscopic surgery, trainees tend to underperceive their autonomy, whereas faculty tend to overperceive trainee involvement. Our objectives were, number one, to understand the trainee console participation time in general surgery robotic cases at our institution, and number two, to assess the perceptions and expectations of our faculty and trainees. All of our robotic cases are performed on dual Da Vinci consoles. Participants were general surgery robotic faculty and trainees who had completed prerequisite robotic training. Novice trainees had minimal or no console experience. Senior trainees were in their final years of training, having had some console experience. From January to June 2019, console participation times, or CPTs, were collected for all robotic cases using Da Vinci technology. CPT was defined as the percentage of active console participation time by the trainee over the total console time. Only cases with a singular attending and trainee were included. A survey was administered online asking participants to estimate average CPTs during the study. Trainees were also asked what CPT they would expect for their training level. 192 cases were included. 5 faculty members operated with 12 of 23 eligible trainees. Survey response rate was 80% for faculty and 65% for trainees. The majority of cases performed were inguinal hernia repairs and cholecystectomies. Cholecystectomies had the highest average CPT at 64%, followed by inguinal hernia repairs at 56%. Faculty, in the gray bars, tended to think they allowed their trainees 13 to 16% more CPT than in actuality, in the blue bars, except for novice trainees in cholecystectomies, where faculty were fairly accurate in perceiving their CPT. Novice trainees perceived a 35% lower CPT than they actually received for cholecystectomies and 14% lower CPT for inguinal hernia repairs. Senior trainees perceived their CPT in inguinal hernia repairs accurately, but surprisingly thought they did 21% more CPT in cholecystectomies than in reality. In general, trainees expected more CPT than they perceived receiving. Senior trainees had less of a difference between their expectation and perception, and they felt they received the CPT they expected for cholecystectomies. In novices, the discrepancy between reality and perception may be because they need more time to be able to complete a certain step of the case. Senior trainees have familiarity and experiences that may result in better aligned perceptions and expectations. We plan to start providing monthly individualized CPT reports to faculty and trainees. CPT does not fully measure a trainee's involvement in a robotic case, so developing technology that recognizes and measures the essential steps of general surgery cases will provide more helpful feedback. Thank you.